Okay, we've been talking about what we can do to boost those serotonin levels. A lot of people, when it comes to things like this and other aspects of health, there's certain people that just like to test. They want to get that readout, want to get a baseline. And while no test is the end-all be-all, nor should it be looked at in isolation, all just part of the decision-making process, no test was without flaws, there are certain ones that we can run. We've talked about how to get the tryptophan to serotonin and the strategies to mitigate the tryptophan steal. Meditating, limiting our stressors, lowering the inflammatory levels. And then as far as proactively getting that tryptophan to serotonin, we talked about breathing exercises, improving oxygenation, getting a little tolerance to the carbon dioxide buildup, thus allowing the hemoglobin to release more oxygen to the tissues. Fascinating stuff, the Bohr effect. Go back and double back, learn about it, institute it, implement it in your own life. We talked about B6, we talked about magnesium levels. We talked about the diet need to be in check just to get the tryptophan, the magnesium, the B6 in order to facilitate that conversion from tryptophan to 5-HTP to serotonin in the first place. And we know, I was going to go there, the gut needs to be intact and optimized in order to digest, absorb, assimilate, and make bioavailable all those nutrients we took in the first place. If all those foundational steps are missing, a lot of this stuff that we're profiling now down the line can come up short. So we want to make sure that those are intact, and you can do those concurrent to some other strategies in order to hedge your bet and expedite potential results. But let's talk about it if someone wants to take a look and measure how are they doing. We talked about tryptophan steal. We talked about one of the ways the tryptophan steal gets propagated is through inflammation. High levels of inflammation in the body leads to the upregulation of the IDO enzyme, which pulls tryptophan away from going to serotonin and off to that kynurenine pathway we talked about, and quinolinic acid, places we don't want to go. But how do we measure that? How can we look at that? We know there's various lifestyle strategies to lower our inflammatory load, but what if we want to take a peek and see where we're at to start? Well, that's what we listed right here. Here are some markers you can take to your physician. Sometimes we check this on people who want to take a look at them, but there's some markers that we can look at in order to check where we're starting out on that inflammatory load. The most common one right here is this HSCRP, high sensitivity C-reactive protein. Basically a non-specific marker of inflammation, but it can give you a good baseline. After that, you can start to look at certain cytokines. Cytokines popular in the news right now due to this ongoing pandemic that rages on and the cytokine storm that has been profiled. But cytokines, ultimately, markers of inflammation. Mainly right there, we're looking at things called interleukins. Interleukins. And on the blood test, you might see them as IL and a certain number. Here are some certain numbers that you want to look for to give you a broader picture of the inflammation, especially if the high sensitivity C-reactive protein is coming back normal. Here is a deeper dive to look at your inflammatory load. TNF, tumor necrosis factor alpha, and interferon. There's a handful of other inflammatory markers you could look at to get a baseline of your inflammatory load. Remember, if that inflammatory load is up, tryptophan steal being perpetuated, more of that tryptophan being shunted away from serotonin, now you're at a deficit. All of the pitfalls of that low serotonin that we have talked about and talked about and talked about. I know you're sick of hearing me talk about it. If that serotonin is low, inflammation could be one of the driving forces. So if you notice some of these things are high, implement strategies to lower them. Watch more of that tryptophan go to serotonin and start to feel better with me.